Dr. Aguinaga, how could you describe how poorly controlled diabetes affect the healing of the wounds?
Poorly controlled diabetes or high blood sugar for the effect affects all the stages of the wound healing. Basically, what you have is a patient that doesn't have the capability of heal itself. His body lost that capability because of the high blood sugar. You have poor circulation, for example, and that actually affects the amount of blood that you can deliver to the area where the wound is. That also decreases the amount of cells that are going to fight against infection in the area where the wound is, and affect the amount of cells that are going to go there to build tissue. Then this is a patient that actually is more prone to develop infections in the wounds that they have. They are less prone to heal the wounds, and having less blood also, they are going to have less oxygen in the tissues. Then all those stages are compromised. Actually, having high blood sugar also is going to increase the inflammation in the area. Besides that, you have also the neuropathy that is going to decrease the sensibility that you have in your feet, and is going to make you more prone to have wounds, and also more prone to put more pressure on the area where your ulcers are, and that is going to decrease the probabilities that you are going to heal. Then actually, it makes you more prone to have infections that can be in the soft tissues or can be also in the bone, which is osteomyelitis. It also makes you less effective on healing your own wound. And the circulation, for example, less blood, less oxygen, less cells to heal the wound, less cells to fight against infection. You are definitely have all the stages compromising in healing.
How do you diagnose, or how can you predict the chances of wound healing? There is any specific test that you usually use in your practice?
There are several tests that we do when we receive a patient with a wound, with already an ulcer that is not healing. One is to establish if there is a compromise in the circulation. We do ABIs. We check ultrasounds of the legs if we think that the patient has a compromise in the circulation. We check for infection, and for infection clinically, it's very important to check if there is redness around the wound, if the wound smells bad or it has secretion. We can do wound cultures to see if there is bacteria growing in the ulcer. We do the test with the monofilament to see if the patient has neuropathy. Protect the wound is very important. Then we always try to offload the wound, and there are several methods for that. There are shoes with a special insoles that we can use. There are knee scooters where we can actually put the patient to walk with the knee scooters to decrease the pressure that they are putting over the wound and the foot. There are several tests and things that we can do to diagnose the problem that the patient has.